inspiring Uganda.
A very good evening to you who's tuned in to UBC TV. Thank you for joining me, Sophia Matovu, on U Health Chat. Now, today we are going to go a little bit lighter on our topic. You know, we're used to bringing for you lots of medical terms, bits here and there. But today, since we're getting into a festive season, many of you are in a festive mood, we are going a little bit light. How to be medically prepared as you get into the festive season, because I know you're going to be everywhere and all over. Now, with me in studio to take us through this topic of discussion is none other than Dr. Derek Juko, who is a pharmacist but is also a member of the Pharmaceutical Society here in Uganda. Doctor, a very good evening to you, and thank you for joining me on the show.
Sure, a very good evening to you. To our viewers, I'm very glad to be here once again. I think we're just counting a few days to the end of the year.
Yes.
Of course, also to Christmas. So I think it's very jolly for me to be here, for sure. Yeah,
now, I know when it comes to issues of ensuring the well-being of the persons out there, you're very, very passionate about it. Now, here we are. We are set to do all sorts of things around the time, especially when you talk about the holiday season. For many, it's about lots of food. It's about partying. It's about drinking. How do we ensure that we are medically prepared?
How do we ensure?
Yes,
that we're medically
when
prepared?
viewers kindly note, we're not saying that you are going to fall sick, but doctor is going to take us through how we can be medically prepared. We will take you through the discussion. Please,
sure.
doctor.
Thank you very much. I was reflecting on that topic, I think 2 days back. One of my colleagues, I think they had gotten leave from work, and all they were telling me, I think today I'm just going to start partying till the as in, you know, so it's very true that towards the festive season, all that we think about is relaxing, traveling, partying, eating, visiting our loved ones, and we never prepare for ourselves medically. So, and indeed it's true that as human beings, we have those that have some ailments. And I think some years back, I was watching some news, and they were showing a hospital where patients that had been admitted during Christmas time, they actually ran away from the hospitals. So you can just imagine what happens around this time. Now, going back to your question, how do we ensure that we are medically prepared? Yes, so there are some practices that we can adapt during this time. Yeah. One of it is doing medical checkups. Yeah, we know that there's some diseases which are chronic diseases. Now we talk about people with hypertension, with diabetes. Yeah, most of us are going to be traveling. Yeah, we are going back to the villages, and sometimes in those villages we don't have probably maybe the medicines that we cannot get the medicines in our villages, and yet those medicines are here. Sometimes we don't have the specialities of the medical workers that attend to us this side. So when we do a medical checkup before you go to the village or before you travel, or even when you're staying, it basically can guide your discipline during that time. I think we've heard of stories whereby someone goes to the village and then we start hearing the guy yaliyeseyo wakati maybe the situation worsens, and then they have to make calls to the doctor, so the doctor has gone to the village. So medical checks are very important for people that have chronic diseases, people that have even, let's say, allergic conditions. There are those people that sometimes have to take those precautions. The medical checkups could be one of those.
When you talk about medical checkups, doctor, yes, I know it's ideally supposed to be the normal practice. But for us here, for many of the people here, I'll speak realistically, they look at a medical checkup like an unplanned for expense, you know, and they only think you only should do a medical checkup for as long as you're feeling unwell. How would you guide us to know the importance? Because it should be a practice that cuts across, and you don't have to wait for only when you have to travel or only when you're getting into the festive mode. Yes.
Yeah, so a medical checkup basically it checks our status of the health, because you see there's some diseases that actually take long to manifest, and maybe the fact that most of us are not medical workers, even when the disease manifests, sometimes you can't tell. I think you've had people who say that I'm feeling headache, it's something else, even something which is bigger. Yeah, that's someone who will be like, I'm feeling some abdominal pain. Yeah, it's something really which is serious. So medical checkups actually, they basically give us the status of our health. So they're very much important. So as we go into these festivities, we're going different areas, and they may not be as I could say they may not have the same amenities. Yeah, let's say if I'm going to my village, yeah, the kind of doctors I would access there may not be the same doctors this side. So it would be very important to go there when I'm not having any kind of worries. Yeah, I know if maybe I check my health and maybe I have to go to the doctor, rush to the doctor before so they break off. I have to do it now, and so that I can kind of enjoy my festive days without any worries. Yeah. So
yeah, that is true.
So that's medical checkups really help us with that. Yeah.
Now, then when you talk about you talked about the bit of planning for the medications they need to move with. There are certain times, is it really like, sometimes people might think that they need to take, do you call it a medical holiday? And by that time they think, after all, I'm going for just a weekend, there's no harm. So why do I need to carry the medications? And they'll think they don't, or other times, some people are shy. If they're this side, maybe it's just you as family, and that side you're going to meet other people, and you do not want the people to know that you're actually on medication. So you deliberately maybe you choose to veer away from taking the medication because you want to enjoy the holiday without feeling psychologically that you're unwell, yet in actual sense you're unwell. We've seen scenarios like that.
Yeah, it's very true actually. Actually, it was one of the things I was going to mention second. Medical refills. Yeah, medical refills. Sometimes we go to the village, maybe you're going to spend, you plan to spend 3 days, you end up spending a week. Yeah. So it's one thing that I advise people that are going to the villages or are traveling, make sure that you have medical refills. Those that actually have chronic conditions. Yeah, right now we are having mental health that are setting. People who have mental health challenges, some of the medications they are on are chronic. Personally, I've been in a situation where there's a friend of ours who got conversions, yeah, and we all never knew why they were getting conversions. It was the first time we actually get to realize that he had forgotten his medicine.
Oh dear.
Yeah, so some of those things, he had forgotten his medicine, so medical refills are very important. But then also when you're traveling up country and probably, let's say you are vulnerable, it's important you travel with someone who understands your condition. Yeah, it's also one practice that we may have to have in mind as we go for festivities, because the objective of going for these festivities, it's been a long year, and you don't want to spend your festive days, those few days you're having maybe in hospital because you've forgotten to carry your medicine or to have your medicine refilled. Yeah, so medicine refills are very important. Make sure that when you're getting the refills, don't just plan for the 3 days or the 2 days they're going to be in the village. Because some of our villages are very interesting. Yeah, you go for the first one day, you're like, no, why am I going back to Kampala? So I think the medicine refills, at least take a refill for like 2 weeks. Give an allowance so that in case of any change of program, you are there. So it's a good practice I would also advocate for people.
Then what about those who believe or who ideally feel at the time they travel they don't have any problem? What are some of those essentials, because I would imagine somebody needs to have at least something with them. It's just like most parents in the house will have a syrup of paracetamol or Calpol for the little ones in case the child gets a high temperature. What are some of those basics like for either the entire family that you make sure at least you have that little pack of yours that you would call your first aid kit that you move with when you're going for the whole festive season?
Yeah, of course. Now, most times I would advise when we are to buy any medicines, especially when we're going for festive seasons, we have to look at what is likely to happen. Some of them, let's say, the medical challenges we may face. Yeah, I think the commonest could be food poisoning. Yeah, for you've seen, especially people who grew up in Kampala for a very long time. When they change environment, when they change food, sometimes they get stomach upsets and all that. So for those ones, we can go to the pharmacy and be advised by the pharmacist which ones can be given over the counter without prescriptions. So those ones, I think we could carry them as we go to the villages, especially if it's the first time. Because I understand, I've seen parents who take their children maybe after 10 years. It's the first time they're going to the village. Now the children go there, instead of having fun with their grandparents, now they're having stomach upsets, now they start panicking, now where is the next drug shop, then they go to the drug shop, the drugs are not there. So I would advise medicines for stomach upsets would be very good to carry. Then we're in the period of flu, coughs, I think also we can get those. Yeah, we can just pack a few, can get those, of course also on advice from a pharmacist in a pharmacy. Then also we'd look at people who have allergies. Please go with your medicines. I've also been in those situations whereby people travel to the village, they have allergies, they can't shower, they can't, so you go home and you're acting so different from the rest, which spoils the entire mood, So when you have allergies, it's important that before you go for the festive season, make sure that at least you had a discussion with your doctor or your pharmacist and you carry some. So that when you go to the village, let's say, and maybe the water is, you cannot shower the water, you have maybe your medicines you can put in the water, you have to boil it or something like that, So allergy. Then also first aid. First aid, especially those that are traveling, much as I think most of the people will be traveling to the villages, but also there are those that are going to be, let's say, on trips, Some maybe is traveling by bus, they're going to Kenya, depending on the means of transport you use. So you could have a first aid box. You just never know what may happen, especially those that are traveling long distances. But even when you're traveling a short distance, it's important at least you have a first aid box. And even just not having first aid box, you may have to familiarize yourself, or at least to know a little bit on how to give first aid. Because you can have a first aid box and an accident happens and you also just look at it. So many people actually have bought first aid boxes, but actually they don't know how to administer first aid. So I would advise everyone, as you go to the village or maybe as you travel this time, try to learn on how at least to administer one of few first aid procedures. Because you could go to the village, because this is a time when we are having fun. Sometimes there's a lot of excitement. Sometimes we've seen a lot of accidents. And now when an accident happens during this time, most of the places have scaled down on human resource. That even if you went to Mulago during festive days, I don't think you'll have the capacity of doctors. Even if you went to a private institute, you'd find that a shift which was being run by 4 people, there are only 2. So I would advise that let us learn 1 or 2 skills on how to give first aid as we go for these holidays. You could help someone out there so that we enjoy, because the objective is to enjoy and relax. So you have to keep that.
Now, from your experience, I believe, of course, you have dealt with several of this kind of scenarios.
Sure.
What are the most common foods likely to cause, like, say, food poisoning? Because remember, surely people are set out to have a blast. And what is a party and what is fun without food?
Yeah, sure. Okay, for me, my principle as a person, if I've never eaten something, I don't try it out.
Which is a good principle, sure.
Yeah, it's a principle. If I don't understand certain kind of food, especially, let's let's say it's the first time, I'll be a bit careful to take it. Yeah, so I don't know if maybe I could kind of extend that advice to a few people. Okay, that is personal, really.
Yeah.
So if you've not taken certain type of food, remember the objective of festive season is to have fun and enjoy. So me, I don't like trying out new things if I'm going to have fun. So I try to avoid. Then the specific foods that really where people get food poisoning, I would say that food poisoning is caused by quite a number of things. It could be handling. It may not be the type of food itself, but I think the handling of the food. I think that's where most of the problems come from. Yeah, but handling is how you prepared it, have you covered it, the place where you're putting it. It could be maybe sometimes we take long to eat this food, so it becomes cold. So mainly food poisoning comes from handling. I may not say that this specific, maybe of course we have some foods which, let's say, let me give an example, liquid foods, yeah? Maybe I would say, if I'm to look at foods where people can easily get food poisoning, we'd also look at those ones whereby maybe when someone is preparing the food, yeah, they get so much in contact with the food. It's like juice, when someone is making juice. Most likely they'll use their hands at one point. Yeah, depending on the procedure they're using. So maybe I could answer that. Yeah, definitely still also looking at the handling bit of the food. Otherwise, there's no specific type of food that will cause food poisoning without handling itself. Yeah.
Then what about in terms of there's some people who even just get sick as they travel? You know, it's called, I think, motion sickness.
Motion sickness, yes.
How do they deal with that? Because there are some families where they'll tell you, other one doesn't travel, it's the one we live in Kampala to stay looking after the home, so they actually lose out on the fun.
Yeah.
And yet, you know, it is not their fault. And maybe some people don't even understand it. They feel like you're inconveniencing them.
Yeah.
You're complaining, you're feeling dizzy, you're throwing up the whole journey to wherever they are going.
That's true.
How
Actually,
should that be managed?
Sure, it's really unfortunate that you know, you miss, you know, traveling. Yeah, for any reason, it's quite unfortunate, and I think it's really sad. But yeah, I think there are quite a number of, I could say, innovations in medicines that are available for such people. So I would say that that really may not be a very big problem in the current times, because there are a number of medicines someone can be able to take. Yeah, but I also know, for the matter of fact, that there are people, because of past experience, yeah, maybe you can find someone with motion sickness, because of the past experience, they even lose the interest of taking the medicine.
Yeah,
so there's always that issue, like someone maybe has phobia for medicines, and maybe they have motion sickness. Yeah? So for me, I think we just have to encourage them, because these are memories which are countless, you know. These are memories that we can't miss. So for those that have motion sickness, I would say that we have solutions. The solutions are there. Yeah, we just have to maybe go and discuss with a doctor or a pharmacist, and maybe we encourage those people to take advantage of those solutions available, so that they don't miss out. Why would you stay in Kampala because of motion sickness? I think it's solvable.
Then the other scenarios, managing the stress.
Yeah.
There are certain, that's a very big area.
Yes.
There's certain times some people think I'm running away from the hustle and bustle in Kampala, and they do not know what to expect the other side.
Yes.
Or when they get the other side, there are other factors that stress it off. You come with your stress from Kampala, thinking you're going to the village to relax and have a good time, and there you are. It's just like a trigger for the stress to go to another level.
Yeah, actually, it's fortunately, actually, I've interacted with some of my colleagues, and sometimes I ask them why they don't want to go to the village, and some of them will tell you that when you go to the villages, actually, we get more stress. We have to go there, we do work, we do this, we do what. So they're like, instead of going to the village, let me just send money, and I stay around. Because I know when I go to the village, because there are going to be very many people, I have to do this, I have to move here, I have to move there. So for me, I think, ahead of the festive seasons, you could have, first of all, identify some of those things that could trigger your stress, and then you work on them, so that you just don't go and fall into things. So I would give an example, because all of us know some of the things which really stress us. Yeah? Okay. If we are lucky to know, at least we have to make sure that we handle them before the festive seasons or before we travel where we think we shall get stress. An example, if maybe housework gives me stress, I don't like doing housework at my place. I know when I go to the village, I'm a child, so I have to do housework. So I'll have to work so hard that this time I'll send money and we hire people at home to come and do the housework. So that when I go back home, it's just me and my parents maybe, you know, trying to relax. Yeah, so stress is real, even during these festive days, even let's say the parents themselves, yeah, when we go back home to visit them, I think they pretty much, you know, that moving up and down, sometimes it stresses people. Yeah, but for me, I would think with proper preparations, because I'm telling you, the culture of planning is missing in very many of us. Yeah, and I think the stress most times, it could be as a result of poor planning. Yeah, you go to the village, maybe you go to the village and you want to behave like you have a lot of money. Yeah, you don't go with a budget. You go with an open budget. So before you know it, the first day you've blown all your money, so you start getting stressed. So I just want to talk about maybe planning. I think planning comes in handy to answer this. Planning reduces a lot of stress, I think.
Okay, now we talked about the conditions. We talked about the category of those who know that they have, you know, chronic conditions, should I say, or conditions that, you know, you have no control over, and ensuring they have the refills and what. Now let's talk about the category of the little ones.
Yes.
How are they managed? These are kids who will definitely, in one way or another, now they are discovering new things. If you're living in an apartment, you've gone to the village, there's a lot of space, there are lots of different kids playing around, and then they want to play around. How should we be medically prepared for those ones?
Yeah, that's true. Yeah, sometimes my advice would be that when these children are going to the village, I think they have to move with an adult. It's very important, because I know sometimes when parents travel with their children to the village, yeah, especially between the ages of 1 to 3 years, yeah, they like discovering, they like touching here, touching there, you know. So, and it's important they go with an adult, yeah, in case, let's say, because all of us know where you're coming from, yeah. So it's important to do a scan through where you're coming from. If you've not developed probably where you're coming from, you stay in an apartment, but maybe at home they stay in a hut. Definitely those are two different environments. So go with an adult to, you know, to see what the children are doing. Yeah, I think that would be one of my best advice. Then we can carry along some of like the medications like we had earlier talked about, food poisoning, because food poisoning is very common. Food poisoning is very common in those young children. Then also allergies. Yeah. So I would say that I think all these children could present different cases, and all those ones have to be handled differently. But I think what is very key is these children have to travel with an adult, either their parent. Their parent is going to be very busy. Maybe when they go back home and you're going to be doing housework at home, maybe go with a maid. Don't leave your maids home. You're going with your children. You know that when you go back home, you're going to be engaged in housework. Then your children are going to be left alone. Yeah? So carry an extra person to basically keep watch on these children. Yeah.
Then what about, you've talked about that, but you know, like at what point do we do the you've seen people when they travel from abroad and they come here, they'll come with anti-malarials. Should this also apply the other way? For us would be assuming and then going into self-medication because of the change of the environment, and now we know the season, the mosquitoes. How should that be dealt with?
So are you trying to say that, let's say if I'm going to my village, I have to carry anti-malarials?
I'm just asking.
Okay. No, I don't think so, because remember, the reason as why those people carry anti-malarials, because in their countries there's no malaria. Yeah? Now here we have malaria. Yeah, the fact that we have malaria, when mosquitoes continuously bite us, we become resistant to some extent. Yeah? That's why and for them, people who come from abroad and they're coming to Uganda, they're taking preventive, so they don't get it. So for us here, we don't take out of preventive. We actually take drugs to cure the disease. So you'd find that there is no need of going with antimalarials to your village, because for us we are not it's already with us. Malaria is already, even in Kampala you can get it. So I think maybe what you can do, when you go to the village, you can maybe practice, maybe you can have those practices to prevent from getting it. Like for example, sleeping under a treated mosquito net. Yeah. You can apply these mosquito repellents in case maybe where you're coming from, like quite a number of mosquitoes. Let's say in a village you could advise, closing the house, because I know during those festive periods sometimes we open the house, and we are bringing in visitors. So we shouldn't forget, maybe at around 5 or 6 or 7 we start closing the house so that the mosquitoes don't come in. So antimalarials, I think those ones are for the Vasamas.
For the Vasamas.
Yeah, for us we are fine.
But what about a scenario where the parent is taking the child, maybe like you talked about earlier, after 10 years is when they remember, oh, you have to go and see grandma or auntie so-and-so in the village. And this child is going there for the first time and being exposed to that environment. I'm not being protective over them, but this is the realities of what is going on.
That's true. Yeah. Well, we have an assumption that even if you stay in Kampala, in the richest suburb of Kampala, mosquito will bite you as you're coming out here in Kampala. So really, malaria prevention, I think we do it so much maybe in pregnant mothers. But in a normal individual, I wouldn't see a reason as to why you would take drugs to prevent malaria. Well, you could do it, but to some extent it could be irrational, to some extent. Unless maybe where you are going, really, the infestation is real. Let's say you have a house in Kalangala where the mosquitoes, you have maybe a house on a water body whereby mosquitoes are always surrounding your place. Maybe in those scenarios you could take some preventive therapy. Yeah, for those you can. But a normal home, I wouldn't see really a reason. Unless also, maybe also I would say that if maybe your child has a history of getting malaria and maybe it does them badly or it affects them in a bad way, yeah, maybe we can think about that. You can have a discussion with your doctor or pharmacist to make that decision. Yeah, there could be those few isolated cases, but if you're Ugandan, I think there is no reason really to take. If you're Ugandan, yeah, the reasons to take preventive therapy may not be very many.
Okay.
Yeah.
And what about the paracetamol?
Yes, we can carry paracetamol. Yeah, Panadol we can carry it. We can carry Panadol just but don't carry a lot. Yeah, don't carry a lot. Just, because sometimes we have pain. But even when someone gets pain, it's important we go just for first aid, I would say.
Yes, to find out why the body is communicating that way. Okay.
Yeah, you could carry some.
Okay, at this particular point, I would like us to take a very short break. And when we do come back, we're still going to continue with our topic of discussion, how to ensure that you are medically prepared for the festive season, because for some institutions, they have already closed down and they have rolled out, and some families actually heading there. But let's take a very short break, and when we do come back, we're going to continue with this topic of discussion. Twogere kuki?
Come and shine in Blascone Paint and win the Twake edition. Buy Blascone Paint worth 100,000 shillings. Get a scratch card and SMS the code to 7197. Not only will you win instant airtime, but you could take home 1 million shillings daily, a share of 4 million shillings each week, or a brand new motorbike with fuel worth 100,000 shillings. Terms and conditions apply. Blascone, color your world.
Meet Stone Atwine, the co-founder of Eversend, a startup that is building financial technology from Uganda to the world. From currency exchange to business banking, Stone and his team are doing it all. Stone embodies the grit and the commitment to take a startup from nothing to something. Stone, keep building. You are unstoppable. MTN, the Unstoppable Network, celebrates you. Download the Eversend app and together, let's support Ugandans like Stone who are driving our country's unstoppable progress.
I got it.
What do you mean you got it? Have you won a lottery?
Yes, this is kind of like a lottery to me.
Let me see. But these are your receipts now.
Yes, exactly my point. See, I had tax areas that had accumulated for a while now, and I was burdened by the penalties and the interest. But guess what? All I had to do was to pay my principal tax, and now I'm free. Yes. How? I mean, it's impossible. It's possible. The government has done it. Yes, the government has given chance to all taxpayers to pay their outstanding principal tax that accrued until 30th of June with no interest or penalties.
But now they're really
Imagine, yes. So yeah, all you have to do is simply pay your principal tax and enjoy the waiver on penalties and interest, and this goes up to the end of December 2023.
But how do I do that to also enjoy the waiver?
All you have to do is simply pay your principal tax to benefit from waiver on interests and penalties that runs till end of December 2023. Pay your outstanding principal tax using the available payment channels, or simply dial *285# or visit the nearest URA office for guidance before 31st December 2023. Remember, this chance comes only once.
Uganda Revenue Authority. Developing Uganda together.
In this family, we can't agree on anything. We can't even agree on what to watch. All the games to play.
Martha.
Ndowoza Mulabi, we can't even agree on what to eat. At least the one thing for now we can all agree on is the soap to use. He likes that it's big and lasts long.
Anti-economy.
I like that it keeps my skin smooth. Ate alina echovu. And the children like that. It smells amazing. Everyone is happy. Movit soap comes in 4 fantastic flavors. Movit family soap is truly soap for the whole family.
Movit. All day confidence.
K Roman Limited banno abakolera Bera Wine omuli ebika ebya Golden Wine, Special Wine, Hibiscus Wine. Kakati nno bakutuusaako Hibiscus Juice ye juice akoleddwa okuyamba mu abalina pressure, sukali, abaagala okusala embuto n'amasavu, okunaaza obukyafu mu mubiri, wamu n'abo abalina abaana abalwalalwala. Ky'olina okukola kati abaana bo bawe Hibiscus Juice, naawe yandyetaaza okwongera obutafaali bw'abasirikale mu mubiri, weeyunire Hibiscus Juice. Hibiscus Juice musange mu supermarkets n'amaduuka gonna mu ggwanga. Gw'omusuubuzi naawe mwetaaze, genda ku K Roman Limited nga basangibwa Wandegeya ku kizimbe kya Moyle wakati wa poliisi y'e Wandegeya ne YMCA. Hibiscus Juice ali mu mills 5 n'ebisatu. Okumanya ebisingawo kuba essimu 0772 50 6155 oba 0704 16 13 98. Nywanga Hibiscus Juice ku lw'obulungi bw'omubiri gwo.
Well, welcome back from that short commercial break. You're still watching You Healthcare with me, Sophia Matovu, and Dr. Derek Joko, and we are talking about how to ensure that you are medically prepared this festive season. Now, Doctor, as we get back still into our topic of discussion, there are certain situations, it's a common thing. The kids have a routine. I'll give an example. When they're going to school, where they are put to bed at a particular time. Yeah? Now here, when the holiday is on, they let them stretch the whole way. Doesn't this mentally affect them? Doesn't it in any way destabilize? I don't know. You might want to talk about it, because there are some who feel that despite the fact that it is holiday, the kid should still keep to the same routine. If the child is in bed by 8 p.m. should it be?
Yeah. Well, that's an interesting, it's a very good question. Okay, I think we need to first of all look at how many hours we're supposed to sleep in a day. I think as we try to control the time when the kids are supposed to sleep, I think the first thing we need to consider is that how many hours should they sleep in a day? I think medically, a normal individual should sleep for 8 hours, at least for 8 hours. Now, achieving those 8 hours, mostly we want to do it during night time. And also, as you see, the body naturally, when as the sun goes down, I think naturally
the body also gets weary.
Exactly. So we have some hormones that come into play, and then we're able to acquire sleep. So me, I'm thinking when kids come back for holidays, definitely in a school, then a more controlled environment. When they come back home, probably it may not be as controlled as school. So for me, I think it's very much important to make sure that they sleep adequately. Those 8 hours, at least we must make sure that those 8 hours they are asleep. And then at least they wake up before 8, I think, to be responsible citizens. That's what I would think. So for me, I would advise that for children, as long as they wake up before 8, they can sleep at any time. As long as they wake up before 8, they can sleep at any time, but also they should sleep for the recommended hours.
Then getting back to our medically being ensuring that we are medically prepared, are there any dietary restrictions you think people should go through this festive season? Because now, I'll give an example, we have anthrax around. And of course, for some people, the affordable bit to have on Christmas is meat.
Sure.
How should we manage?
I think, like you said, anthrax could be one of the diseases, I think, that are affecting the livestock. So I think dietary restrictions could be guided. They could be guided now, like anthrax. I'm sure maybe it's guided by the Ministry of I don't know, livestock and farming. I don't know, something like that. So that could be one of the things that could guide the restrictions. Another thing, I would think that people shouldn't mix a lot of foods. The more you mix things, I think there are high chances of cross-contamination. So I would advise simple dishes, if it's possible. Simple dishes, but maybe you find someone is taking mutton, they're taking beef, they're taking chicken, they're taking this, and someone goes and puts all of them on the same plate. Most likely they've used different spices. So the chances of getting stomach upsets become high. They're using a lot of oil here, and also they're using oil here, So for me, I think mixing a lot of foods, I think would also be, it could be looked into. Because ideally, much as eating forms part of the fun,
True.
It forms, I think, maybe the biggest part of the fun.
True.
So I think overmixing, different varieties of foods, we may have to take note, I think. We have to take note. That one I would advise.
Oh, wow. Then how do we prevent illness? Because there are certain times, the last thing you want is for your holiday to be cut short because somebody has fallen sick in the village, and then you have to come. You actually don't trust maybe the healthcare system where you have gone to the village, and you feel you're more comfortable with this particular health practitioner that you're always going to for consultation.
I think that question, how do we prevent illness? It's a very good question, but then also I really want to challenge all of us to work on places where we come from, so that we can create the same environments. Because if we are to get illnesses when we're in our villages, I think to some extent we have ourselves to blame. To some extent, because you can make you can upgrade your village to almost to be like your place, especially if you have the means. So I would say, I think the first preventive measure is that if you have the means, because preventing disease, I think the number one thing is hygiene. It's the number one. It's hygiene. Yeah, so if we work on the hygiene in our villages, yeah, I think that could be the number one. Because for that small time you'll be there, if you did everything right, you did your medical refills, you did your medical checkup, you followed all the advice that probably your doctor gave you, I think the only thing that may make your holiday a bad one could be mostly on hygiene. And maybe now in Uganda it could be on malaria. And I think all those things we have control over them to some extent. So there is this feeling, especially for people that stay in Kampala, when you go to the village, you're seeing that most likely this is the place where you're going to get this infection, you're going to do this, you're going to get that. But you also have the powers to change that, especially if you have the means.
Yes, sure.
Yeah, so that goes back to planning. Yeah, if going to the village is one of the things that you treasure most. So if in the village they don't have proper toilets or latrines, I think the next holiday you're like, okay, let me work on the latrines at home. Yeah, maybe if I go this time, let me send money and they buy toilet sundries. So you don't go there, you carry things, a lot of buveras from Kampala. You clearly know that in your village the toilets are not good. Instead of carrying those buveras, reduce on that budget. Have some budget for hygiene so that they work. But even it shouldn't even be only festive seasons, because that could also look weird. So I would say that maybe I would call upon all of us that we need to ensure that it's proper hygiene where we come from. Because it's surprising. You would find some people who stay in mansions in Kampala, go to their village and you're like, okay. Yeah, so for me I think that would be the best preventive. Create the same environment. At least the things you have control over. For the doctors, of course you may not move with your doctor. Yeah, you may not move with your doctor to the village. Yeah, but I would think if we have handled the hygiene issue, then I think for most of the doctors, we can just inform them and maybe seek for their advice. You tell them that depending on the condition you're having, or maybe your children are having, yeah, you could inform them that maybe I'm going to be away from you, maybe for 4 days. Is it okay? Then they will give you permission. Because for me, I've seen certain conditions whereby a doctor would tell you, I don't advise you to travel, just stay here. So if your doctor says so, please don't go against it. Maybe you postpone after the festive season, you can still go back home. I know there's always that temptation. Yeah, it's a big temptation.
Then how about if your doctor still gives you all the necessary tips to move, and it's your responsibility, or your doctor guides you to go to like the nearest health facility, and maybe at the point when you have a scenario during this holiday, your doctor can have a conversation with the doctor on the other end, and they're able to see to it that you get well. Yeah,
that is allowed actually in medical practice. That's allowed. Doctors are supposed to share information. Actually, I think if I can remember very well, the only person a doctor is supposed to share information about a patient should be a fellow doctor, and that has to be during working hours, working time. You cannot share information about a patient maybe when you're taking a beer or so that is very much allowed. Yeah, and I think most doctors are very much free sharing information as long as you notify them. Yeah, even then they can write a notice in case maybe they're going to be very busy. You can tell them, write for me a notice, and I take it to the doctor everywhere I'm going. Yeah, so for them they can write a notice. They can just write a history of your condition. So that when you go the other side, you can present it, and this person will get to know exactly
how to manage.
Because I know there are some doctors probably may be traveling out of the country, or maybe they may not be reachable. So you could ask them for some bit of documentation. You're like, okay, I'm traveling to the village, but I'm not sure whether you'll be available. Maybe on top of me having your number, do you mind writing down something for me? So that in case maybe you're unreachable, I can be able to show this to the next doctor. Yeah, to handle. Case.
Now my final question would be, we've talked about the food, but we are ignoring one aspect that many people look for. I'm sorry, I'll not use many people. That some people are looking forward to having besides, they say, what's fun without the bottle? How should they be medically prepared? Because there are some of them, once they know that now they are practically on a holiday,
Yes.
are set out to really have a lot of fun. I had somebody ask another person of, now when are you starting to drink? As in, because we've broken off, so when do you start?
When you start.
And without realizing to what extent.
Yeah.
But when do you start? So I said, okay, assuming this person is broken off today, this is 21st. Now, and they resume work maybe after 2 weeks. Does this mean they're going to be on a drinking spree, or they're going to be bar hopping?
Yeah. Actually, to my knowledge, I know that, you see, drinking, according to science, has advantages and disadvantages.
Yeah.
And at different concentrations, yeah, it has different effects on our bodies. So for those of you that are planning to drink a lot, definitely you end up getting depressed. Yeah, because for me, I think the festive season is about having fun. So if you plan to drink a lot, I think you're going to get depressed. So where would you push yourself into depression during this festive season? Yeah. Trying to answer your question, how should they be medically prepared? Okay, I think we would look at, well, if I answer that question, then people probably will now intend to drink because they know that
you've given them the remedy.
The remedy.
Yeah. Oh, okay.
So maybe I would just advise on behaviors. Yeah, on the behaviors. I think they should just reflect. Yeah, they should just reflect. This is a festive season. I'm supposed to have fun. I would advise that people shouldn't drink a lot, because when you drink a lot, definitely you get depressed. Yeah, drink moderately. Yeah, drink moderately, because moderate drinking is also not bad. Yeah, medically. Yeah, because it can take away the anxiety. Yeah, it brings a little bit of excitement. And then also it could be something for social fitting. People can fit in socially. So moderate drinking, I think, is fine. Yeah. Over drinking, you would even get hospitalized. Some people even go into coma. So there are more disadvantages. Yeah, and the year is about to end. Why would you want to treat yourself that way? And now we are going to the village. Yeah, you'd be acting funny. Maybe if you have children, yeah, it could be a very bad example. So I think moderate drinking would be okay. Then don't drive. Maybe that could be the medical advice I would give, or if it's medical.
No,
when you're drinking, please don't drive. Yeah, if you overdrink and you're not able to drive, get someone to drive you, or maybe just stay until when you're fine, then you can drive. So other medical, maybe I would think about first aid in case someone maybe drinks a lot. Which kind of first aid we can give them? Yeah. So because most times when you drink a lot, this alcohol, sometimes it's going to diminish our glucose levels. Yeah. So maybe when someone drinks a lot, maybe they go into coma. When you rush them to hospital, we should be able to tell the doctors what has really caused them to go into coma. Sometimes they give them glucose. You can give them soda, something which has sugar in it. Yeah. Even maybe before you drink, make sure you've eaten. Yeah? Don't drink on an empty stomach. Clearly speaking. Yeah. Don't drink on an empty stomach. When you drink on an empty stomach, you'll collapse. Yeah. So make sure that before you drink, first eat. Yeah. Don't drink on an empty stomach. Don't drink at the same time when you're smoking. That's a very dangerous combination. So I think my medical advice would be, if you cannot avoid drinking and you have to drink, make sure you've eaten. Yeah, you will not make people around you get worried.
Okay.
Yeah.
Okay, thank you so much, Dr. Derek Joko, for those tips that will, I'm sure a person who's been watching will know how to safely manage and enjoy the festive season while they are medically prepared.
Sure.
Now, there's certain times you might think that maybe we're being too much, but this is the reality. Many people, as they get out to celebrate and to make merry, have had issues. I'm sure if you've listened in right from the beginning of the show, you have picked a tip or two. If these are some things that you have been doing, then well, good to go, you're on the right track. But we would like to say Merry Christmas to you from me and Dr. Derek, and enjoy the festive season safely. Stay safe. Catch you next week, same time. Keep watching UBC TV for Rhoda Ngonzi is coming your way shortly with the 10 o'clock news.